looking forward to bringing you an exclusive story tonight at 11. We're calling it CBD. Could it be the key to chronic pain relief?
All right, now CBD is a chemical compound you find in the marijuana plant without the material that makes you high. The industry is exploding right now. More and more people are using it, but there is still a lot of confusion and some skepticism out there. Joining us now is Dr. Hervé Damas. He is a medical doctor and a big believer in CBD, and I just found out a little while ago you're a former football player.
Correct.
So you got involved in this out of your own experience.
Correct.
Tell us about CBD.
So in the cannabis plant or the hemp plant, there are a number of molecules called cannabinoids. THC is a popular one. CBD is one that's gaining a lot of popularity, as you just mentioned. CBD allows you to experience a lot of the therapeutic benefits of the plant without the psychoactive effects. So you can start to feel better and experience the relief that people are experiencing from cannabis without being high.
What kinds of patients are we talking about here?
So I originally started with athletes, being a former football player and dealing with their issues, but I predominantly treat women. That would be my major demographic, and we're
Really?
talking about, career women, moms, a combination of the two, a lot of chronic pain issues, and that's the number one reason people go to doctors anyways, because something's hurting them, so there's no difference in the cannabis space, but the stresses of life, menstrual cramps, migraines, inflammatory diseases or autoimmune diseases. So a lot of chronic pain issues, a lot of anxiety and sleeplessness, and of course, serious psychological issues, depression, PTSD.
How is the CBD taken? I understand it's an oil. It could also be a pill.
Yes. So through the wonders of modern technology, we we the CBD in a number of different formulations. So you can have it as a pill, you can have it as an oil. We have gummy bears, which are our most popular because you can consume your medicine without the profile of a medicinal product.
Right.
You can have topical creams, which take away local pain and inflammation. There are suppositories, there are dissolving, we have hemp water, just a number of different formulations.
Do you need a prescription for this?
You do not need a prescription for CBD as long as it is less than 0.3% THC. Anything above that in the state of Florida, you would need what's called a low THC medical marijuana prescription. But anything below that, you can actually purchase from a store.
Okay. For so many years, there's been such a stigma surrounding any type of marijuana, any type of medication derived from marijuana. What do you want to clear up for people?
I'd like people to know that this plant has been in existence way before we arrived here, and it's been part of a human's medicine cabinet up until the 1930s, where we had the first kind of wave of prohibition in the U.S. So this is something that's always been readily acceptable and used by human beings for a number of ailments, and now through grassroots activism, people are starting to understand the benefits of the plant and kind of float away from the stigma, but there's still a lot of work to be done.
And you talk a lot about pain and women who have it, and a lot of times they've been going to opioids and other kinds of pharmaceutical drugs that are manufactured. Why is this a safer alternative?
There are a few reasons why. Number one, it's not synthetic. Although there are synthetic formulations available, you can get the natural thing. So most people are comfortable as they get away from synthetic medicines to find something all natural. Number two, the way CBD works is that it doesn't actually introduce something into your body causing an effect. It modulates the effect of THC, and it actually helps regulate something called your endocannabinoid system. Your body actually makes these molecules and produces them, and an absence or a lowered production of them causes a number of these ailments that we suffer from. And so as you supplement with CBD, you allow your body to either produce more or maintain more of what you have and get you to a state of homeostasis, which is what we're all looking for, which is kind of like you're cool, everything's fine, no worries.
And I have two questions. How long does it take, for people to see a difference in the pain that they're suffering through? And also, have you seen any side effects?
So immediately you can have formulations that provide pain relief or anxiety relief in as little as 5 minutes based on whether it's a spray, you have nasal formulations for inhalation, vaping is a popular manner, so that can happen within minutes. So we're talking about acute episodes of pain like migraines. People who suffer from migraines, you can get relief immediately, 5, 20 minutes. And then that can last, the half-life of CBD is 9 hours. So depending on your dosage, you can have that in your system for 9 hours. And then as you slowly continue to daily supplement with it, you can start building up the levels in your body. And then, you're looking at going through your life and having some of these things that are bothering people, whether it's the anxiety or the depression, having less of a deleterious effect on your daily activities of living.
Any side effects?
So side effects, the number one side effect, which is a great side effect, most people like it, is somnolence, meaning it will make you sleepy. The more of it you take, the more sleepy you get. So I use it personally to go to sleep.
Not to go to work.
Not to go to work. And the second side effect, some people have experienced diarrhea. There are rare people who have allergies, but that's very, very rare. Nothing, no anaphylaxis or anything like that. Maybe some hives or itching, but you can tell early on.
It's an herbal supplement.
Correct.
Dr. Hervé Damas, thank you very much for joining us.
Thank you for having me.